This is second part of lecture on gametogenesis. In this video, I discuss oogenesis. Oogenesis is defined as sequence of events by which primordial germ cells or oogonia are transformed into mature oocytes. Sequence of events by which primordial germ cells are transformed into mature oocytes. Process of oogenesis starts before birth of female child. At the end of fifth week of development, primordial germ cells reach in developing gonads from yolk sac. Just after their arrival in developing gonads of female baby, process of oogenesis is started. These primordial germ cells undergo mitotic cell divisions and are transformed into oogonia. Primordial germ cells undergo mitotic cell divisions and are transformed into oogonia. Process of oogenesis. This conversion of primordial germ cells into oogonia is started just after their arrival in gonads. Recall previous lecture and compare the concepts of spermatogenesis and oogenesis. At the end of fifth week of development, primordial germ cells have arrived in gonads of both developing male and female baby. In male, once primordial germ cells have arrived in developing gonads, they remain dormant till puberty of that male. At puberty, these primordial germ cells are transformed into spermatogonia and process of spermatogenesis starts. Means spermatogenesis begins after birth at puberty. Process of oogenesis starts just after primordial germ cells have arrived in developing gonads of female baby. Means oogonia starts in developing gonads of female baby before her birth, when she is in uterus of her mother. Primordial germ cells undergo mitotic divisions and are transformed into oogonia. And during third month of development, oogonia undergo mitotic divisions to produce primary oocytes. Oogonia undergo mitotic division during third month of development, undergo mitotic division and produce primary oocytes. In developing ovary, all oogonia which are derived from single primordial germ cell are present together in cluster and are surrounded by single layer of flat epithelial cells. See in this diagram. This is surface epithelium of ovary. Surface epithelium of ovary. These are epithelial cells and these are nuclei of these epithelial cells. In ovary, primordial germ cells are transformed into oogonia, and all oogonia which are derived from single primordial germ cells, those oogonia are present in clusters. They are present together. These are oogonia. And these are surrounded by flat epithelial cells. These are flat epithelial cells which surround these oogonia. These are nuclei of these epithelial cells. These epithelial cells are derived from surface epithelium of ovary. These are oogonia. These all are oogonia. These large cells are primary oocytes. As some oogonia are transformed into primary oocytes. This diagram shows a segment of ovary during fourth month of development. As primary oocytes start to appear during third month, so this diagram of fourth month shows there are primary oocytes. Some oogonia are transformed into primary oocytes. Oogonia continue to divide by mitosis and produce oogonia and primary oocytes so that their number increases in ovaries till fifth month of development. Fifth month of development. By fifth month of development, number of germ cells in ovaries is maximum and it is approximately 7 million. 7 million in each ovary. After this period, oogonia and primary oocytes starts to degenerate and their number decreases. During 7th month of development, almost all oogonia are transformed into primary oocytes. Now let me make diagram of ovary at 7th month. At 7th month, this diagram is at 4th month. Similarly, this is surface epithelium of ovary. These are epithelial cells. These are nuclei of epithelial cells. And now at 7th month, almost all oogonia are transformed into primary oocytes. This is primary oocyte. This is another primary oocyte. Another primary oocyte. Here each primary oocyte is separately, individually surrounded by epithelial cells. These are epithelial cells with green color, which surround each primary oocyte. Means each primary oocyte is individually surrounded by epithelial cells. at 7th month. In similar way, all primary oocytes are surrounded by epithelial cells, flat epithelial cells. These flat epithelial cells are also called follicular cells. And there is connective tissue between primary oocytes, connective tissue of ovary. This with blue pen, this is connective tissue of ovary present between primary oocytes. At 7th month, almost all oogonia are transformed into primary oocytes. Very few oogonia may exist near the surface epithelium. This is primary oocyte, which is surrounded by flat epithelial cell. These are primary oocytes, and this is oogonium. At 7th month, very few oogonium may be present near the surface epithelium of ovary. Many oogonia are transformed into primary oocytes and other are degenerated. Primary oocytes start to appear during 3rd month. As primary oocyte is formed, it undergoes first meiotic division and it is arrested in diplotin stage of prophase of first meiotic division. As primary oocyte is formed, it undergo primary oocyte. It undergo first meiotic division. But it is arrested in diplotin stage of prophase of first meiotic division. Why this is known that in older mothers there is increased risk of birth defects. Why this is said to be that with increasing maternal age, risk of genetic disorders in children increases. Understand the answer. Primary oocytes enter the first meiotic division and remain arrested in prophase. They remain arrested for many years. This arrested state is due to oocyte maturation inhibitor. Oocyte maturation inhibitor. Oocyte maturation inhibitor produced by epithelial cells surrounding epithelial cells. The only primary oocyte which will ovulate, come out of arrested state and complete first meiotic division to produce secondary oocytes. Means just before ovulation, primary oocytes complete first meiotic division. Primary oocytes are formed and entered in first meiotic division and are arrested before birth of female baby, and ovulation starts at puberty. If ovulation occur at the age of 15 years, it means primary oocyte remain arrested in prophase of first meiotic division for more than 15 years. And if ovulation occur at the age of 40 years, it means primary oocyte remain arrested for more than 40 years. Longer the time primary oocyte remain arrested in first meiotic division, there is more chance of meiotic errors such as non-disjunction to occur in primary oocytes. Non-disjunction is failure of homologous chromosomes to separate. Normally, during first meiotic division, homologous chromosomes pair and then they segregate. See here, this is suppose nucleus which is undergoing first meiotic division. This is one chromosome and this is another homologous chromosome. During first meiotic division, these homologous chromosomes are paired and then they will segregate. When this primary oocyte undergo first meiotic division and will produce normal, these chromosomes separate and each chromosome enter in different daughter cell, and this daughter cell receive another chromosome. This is normal phenomena, but non-disjunction is failure of this separation of chromosomes. So when non-disjunction occur, one daughter cell receive both chromosomes and the other receive no any chromosome of the pair. Means here these homologous chromosomes are not separated, are not segregated, and both chromosomes went to one daughter cell. The other daughter cell remain empty. This is called non-disjunction. So, frequency of meiotic errors in primary oocytes is directly proportional to the duration of arrested state. If ovulation occur at 20-year age, primary oocyte has remained in arrested state for about 20 years, and if ovulation occur at 40 age, means primary oocytes has remained in arrested state for about 40 years. This oocyte, which has remained in arrested state for more than 40 years, chances of chromosomal abnormalities are more, and if this oocyte is fertilized, there will be more risk of birth defects in developing child. This is one answer of question. Therefore, from medical point of view, the ideal maternal age for reproduction is from 20 to 35 year. Now come back to the oogenesis. We have discussed process of oogenesis up to 7th month of development. Now let me make a diagram of a segment of ovary at birth. This is surface epithelium of ovary. Epithelial cells, their nuclei, and at birth ovary contains primary oocytes, these are primary oocytes, these are primary oocytes. Each primary oocyte is individually surrounded by flat epithelial cells. These are flat epithelial cells, also called follicular cells, which surround primary oocyte. These are nuclei in epithelial cells. In this way, in similar way, all primary oocytes are surrounded by these flat epithelial cells. At birth, all oogonia are transformed into primary oocytes. No any oogonia exist at the time of birth. All oogonia are transformed into primary oocytes. This is connective tissue of ovary present between primary oocytes. Each primary oocyte, along with its surrounding epithelial cells, is called primordial follicle. Each primary oocyte, along with its surrounding epithelial cells, is called primordial follicle. So, at the time of birth, all germ cells present in ovary are primary oocytes. No any oogonium is present at the time of birth. It means all oogonia have developed in primary oocytes before birth, or no any primary oocyte is formed after birth. Also, note that at the time of birth, ovaries contain primordial follicles. The part of process of oogenesis which we have discussed up to now is called prenatal maturation of oocyte. And now we discuss postnatal maturation of oocyte. At birth, total number of primary oocytes in ovaries is between 6 lakh to 8 lakh. During childhood, most primary oocytes are degenerated. At puberty, approximately 40,000 primary oocytes are present. Out of these 40,000, about 500 complete their first meiotic division and become secondary oocytes and are ovulated. Very few of these ovulated oocytes are fertilized. Till puberty, ovaries contain primordial follicles. At puberty, primordial follicles starts to grow. See, this is a single, I am drawing the single primordial follicle. This is primary oocyte, and these are flat epithelial cells surrounding this primary oocyte. Nucleus of epithelial cells. This is primordial follicle. Surrounding here connective tissue of ovary is present. This primordial follicle starts to grow. Primordial follicle starts to grow at puberty. As this primordial follicle start to grow, these flat epithelial cells become cuboidal, like this. These epithelial cells become from flat, these now they become cuboidal. And these are nuclei of these epithelial cells. There is single layer of cuboidal epithelial cells, and this is basement membrane of these epithelial cells, and there is connective tissue of ovary surrounding this connective tissue. And these epithelial cells start to secrete a glycoproteinous substance between epithelial cells and primary oocyte, and that glycoproteinous substance which is secreted by these epithelial cells between primary oocyte and this epithelial cell is called zona pellucida. This with green color I am drawing zona pellucida at this location. So this is growing follicle. Growing follicle. As growth continues, this growing follicle develop into primary or pre-antral follicle, which I draw on next page. As growth continues, primary or pre-antral follicle is formed. Primary oocyte surrounding. As growth continues, the surrounding cuboidal epithelium produce many layers. This is zona pellucida. Zona pellucida, and now cuboidal epithelium from single layer. Now there are multiple layers of cuboidal epithelial cells. These are cuboidal epithelial cells. For the sake of easiness, I am drawing these cuboidal epithelial cells as circular. These are cuboidal epithelial cells, and there are many layers. Many layers of cuboidal epithelial cells And at this stage, these cuboidal epithelial cells are called granulosa cells. Granulosa cells. Here is basement membrane of epithelial cells, and this is connective tissue of ovary. These multi-layered cuboidal cells are called granulosa cells. As growth continues, this is primary or pre-antral follicle. This grows into antral follicle. Primary oocyte surrounding zona pellucida. These are surrounding granulosa cells. This is antral follicle because of development of antrum, which I will draw. This is antral or vesicular follicle. Surrounding connective tissue forms a layer called this layer. Surrounding connective tissue of ovary forms a layer around this antral follicle, and this layer by green paint, this is called theca folliculi. Theca folliculi. And this is antrum cavity. Fluid starts to accumulate between granulosa cells. Fluid is accumulated more at a site where cells are pushed and a cavity is created. This cavity is called antrum, and this is filled with fluid. This cavity is called antrum, and this antrum is filled with fluid called antral fluid. Antral fluid. This is called antral or vesicular follicle. This further grows into mature vesicular follicle or graphene follicle. Now I am drawing mature vesicular follicle. primary oocyte surrounding zona pellucida, and now granulosa cells. These are granulosa cells. As this antral or vesicular follicle further matures, this antral cavity, this antrum enlarges, fluid is more accumulated. Now see. This is antral cavity. Let me complete the figure. Definitely these are epithelial cells, all these have nuclei in their cells. This is mature vesicular follicle. Mature vesicular or Giraffian follicle. Antrum is enlarged and filled with follicular fluid. Primary oocyte is pushed from center to the periphery by the fluid. Theca folliculi, this is organized in two layers. This is basement membrane of granulosa cells, and this theca folliculi, this layer is organized in two layers. Internal layer called theca interna and external layer called outer layer, which is called theca externa. This is inner layer and this is outer layer. Outer layer. This theca folliculi layer is organized in two layers, inner and outer. Inner is called theca interna. Theca interna, and outer is called theca externa. Theca externa. Theca interna is rich in blood vessels and consists of secretory cells which secrete steroid, and theca externa is a fibrous layer which become continuous with surrounding connective tissue of ovary. Surrounding connective tissue of ovary. And these granulosa cells which surround the primary oocyte are called, these granulosa cells are called cumulus Oophorus. With each ovarian cycle, 15 to 20 primordial follicles begins to grow, but usually only one reaches full maturity. Remaining degenerates during their maturation. Means out of 15 to 20 growing follicles, only one become Graafian follicle or mature vesicular follicle. Less commonly, two or rarely more than two may reach full maturity and ovulate. Each primary oocyte remain arrested in diplotin stage of prophase of first meiotic division till ovulation, and ovulation starts at puberty. When mature vesicular follicle is formed, luteinizing hormone is secreted in very high concentration. As compared to its normal concentration, it is secreted in very high concentration when mature vesicular or Graafian follicle is formed. This very secretion of very high concentration of luteinizing hormone is called luteinizing hormone surge. Due to this surge, luteinizing hormone induces primary oocyte to complete first meiotic division and produce two daughter cells. One is called secondary oocyte and other is polar body. See in this diagram on next page. This is primary oocyte arrested in diplotin of prophase of first meiotic division. It is arrested due to oocyte maturation inhibitor. This is zona pellucida, and definitely here are granulosa cells. This primary oocyte, due to luteinizing hormone surge, luteinizing hormone, very high concentration of luteinizing hormone induces this primary oocyte to complete its first meiotic division. And then this primary oocyte produces this. Let me draw first zona pellucida. This primary oocyte divides into, produces one secondary oocyte. This is secondary oocyte and other polar body. This polar body is present between secondary oocyte and zona pellucida. Unlike spermatogenesis, division of cytoplasm is unequal. Secondary oocyte receive most cytoplasm and polar body receives very little cytoplasm. During spermatogenesis, cytoplasm is divided equally but incompletely. During spermatogenesis, recall previous lecture, cytoplasm divides cytoplasm is divided equally but incompletely. During oogenesis, cytoplasm is divided unequally. Secondary oocyte receive most cytoplasm and this polar body receives almost none. During oogenesis, cytoplasm is divided unequally but completely. Remember this difference. Secondary oocyte undergoes second meiotic division, but it is arrested in metaphase of second meiotic division before ovulation. then ovulation occur. If woman is taking oral contraceptive pills, ovulation will not occur. Secondary oocyte will proceed and complete second meiotic division only if it is penetrated by sperm. Secondary oocyte, as a result of second meiotic division, similarly produces a polar body and an oocyte which receive most cytoplasm and is fertilized by sperm. If sperms are not available, then secondary oocyte is degenerated within 24 hours after ovulation without coming out of arrested state. Unlike spermatogenesis, during oogenesis, each primary oocyte produces one mature oocyte. In spermatogenesis, each primary spermatocyte produces 4 mature sperms. Finally, there is comparison of male and female gamete. Male gamete sperm and female gamete oocyte. Female gametes are large, male gametes are small, very small. These are large. Male gametes are highly motile. Highly motile because of tail. Female gametes, oocytes, are non-motile. Female gamete oocyte is surrounded by different layers. For example, zona pellucida and a layer of granulosa cells, and these layers are not present around the sperm. According to sex chromosome distribution, there are two types of sperms, but only one type of oocyte. On this basis, there is only one type of oocyte, but there are two types of sperms. Those, number one, those containing X sex chromosome, and number two, those containing Y sex chromosome. Due to difference in sex chromosomes of sperms, the type of sperm, either X or Y, the type of sperm which fertilizes oocyte primarily determine the sex of developing human.